everybody, my name is Heather Jordan and I'm an associate professor in the Department of Biological Sciences at Mississippi State University. I'm part of a team that is exploring novel weapon evolution for pathogen spread and ecological persistence. Specifically, we're measuring diversity of the environmental pathogen Mycobacterium ulcerans in aquatic habitats in French Guiana. But I've researched the ecology, transmission, and pathogenesis of M. ulcerans in the lab and also through fieldwork in West Africa for over 15 years. So I feel really passionately about my work, and I love what I do. I love working with patients. I love conducting field work. I love doing lab work and working with students. But now I want to convince you why we should be conducting research on Mycobacterium ulcerans and other non-tuberculosis mycobacteria. And this is going to be presented to you in multiple parts. Pretty much because I can't sum it up in 5 minutes. So there's going to be multiple parts to this presentation given over time. But before I jump in, I wanted to make sure to mention that the work that we're conducting is a collaborating effort, and the list shown here includes those collaborating on the currently funded NSF grant. And I also need to stop and mention that any opinions, findings, conclusions, or recommendations presented on this platform are those from me, the presenter, and do not necessarily reflect the views of the National Science Foundation. So again, listed here are collaborating universities on this grant, including Michigan State University, University of West Alabama, University of Montpellier, IRD, CNRS, Investments d'Avenir, and INRAE. But collaborations are ongoing with many national and global institutions, not only those listed here, but many others. As I mentioned, this is a multidisciplinary effort, and there are many subject matter experts that are conducting this research. And also, this work is currently funded through the National Science Foundation, but some of the preliminary data that I'm going to be presenting throughout the different modules were funded through Mississippi State University Department of Biological Sciences and also the Office of Research and Economic Development. So why should we be researching Mycobacterium ulcerans? Well, first, ulcerans is the causative agent of Buruli ulcer, and Buruli ulcer is a necrotizing skin disease that's prevalent in West Africa and also Australia. Buruli ulcer is a neglected tropical disease and is actually the second most common mycobacterial disease after tuberculosis in many West African countries. And the disease is found in tropical and subtropical regions around the world, with cases reported in at least 31 countries, as shown here in this top left figure, those that are in red. Emulcerans produces a lipid called mycolactone that prevents the immune system of those people who are infected from responding as it should to emulcerans infection. Mycolactone is also cytotoxic, leading to ulceration and necrosis. And you can see in this top right-hand figure here, the first clinical signs of infection is a firm, painless nodule or papule, and that's in that top right figure, that first view. If it's left undetected or untreated, the disease spreads into the subcutaneous fat and causes necrosis that leads to ulceration. And actually, ulcers have been known to cover up to 15% of the body. The disease can also lead to loss of organs, such as the eyes or breast, and can also cause joint contracture and atrophy, and that's also shown in that top right figure. And even in previous years, autoamputation has been known to occur. Another reason why we should study emulcerans and Buruli ulcer is that Buruli ulcer disease often has a social, cultural, psychological, and economic impact on the affected populations, particularly in rural West Africa. The disease has been associated with witchcraft or evil eye or voodoo by some local populations, and so patients are often stigmatized within their community. Infection can lead to social isolation, loss of days at school and work, and even the inability to get married. And the psychological impact has been mainly attributed to factors such as disfigurement, physical pain following surgery, financial burden during treatment or even after treatment, self-dissatisfaction for not fulfilling one's own gender roles, and of course stigma and marginalization. Also, in West Africa, disease occurs in impoverished populations who often live far from health facilities or who are dependent on farming, fishing, or other jobs requiring work in natural environments. So, the disease can yield a large economic burden due to disruption of their livelihood and earnings, as well as costs for travel and hospital stay. Also, some patients are sometimes abandoned during treatment at clinics due to the stigma and financial burden that leads for these patients to suffer from loneliness, humiliation, insecurity, and hopelessness. And even in developed countries, a significant economic burden is imposed by Buruli ulcer due to expensive antibiotics that are sometimes not covered by health system schemes. Another thing about Buruli ulcer and Mycobacterium ulcerans is that both of these, the prevalence of Buruli ulcer and M. ulcerans presence is associated with slow-moving aquatic environments where M. ulcerans DNA has been found associated with invertebrates, water, and biofilms. But even though we know this and we can detect M. ulcerans in aquatic environments, we don't know how people are acquiring Buruli ulcer. We don't know how M. ulcerans is transmitted to the human host. So neither do we know the transmission, nor do we know the complete list of reservoirs or environmental niches. So this is a disease that causes significant morbidity, significant suffering and disability, significant stigmatization, and yet we don't know the factors that lead to people acquiring the disease and how it's being transmitted. So researching all aspects of M. ulcerans and Buruli ulcer are needed in order to prevent transmission, reduce morbidity, and also reduce stigma. So that is the end of part 1, and we will continue on with 4 other reasons over time of why we should be studying M. ulcerans and other non-tuberculosis mycobacteria. Thank you.